And action.
Hi 101 class, I'm Derek again, Professor Hernandez, and I want to invite you to a opportunity to ask my students some questions. I'm going to ask them some questions and maybe this will help you along the way in planning to become a nurse and enter nursing school. My students have prepared so much for this career and they're with me right now. I'm in the hospital with them and I would love to go over some of the questions that I prepared and will ask them. And so, Faith, I'll go ahead and take the camera. Thank you. All right. So the first question is, does anybody in the class here, does anybody ever had a job where you were responsible for the care of others?
Yes.
Okay, so I'll go ahead and answer that question.
Oh yeah, I'm currently working as a CNA at a retirement home in San Diego. So when I was over there, I'm taking care of the patient who is dementia.
Okay.
So like difficult and also some assisted living over there.
Uh-huh.
That's my specialty for taking care of them.
Okay. Does anybody ever had a situation where they experienced being in a situation where there was a lot of blood, and how did you handle it?
Yes.
Yeah? Go ahead and introduce yourself.
I was working as a phlebotomist, so that's obviously a lot of blood, and a birth assistant for a midwife. And with birth, sometimes our patients can hemorrhage after they have their baby, and you just have to be really aware of like passing out from blood loss. Usually with a lot of blood loss, we push IV fluids, and yeah, lots of cleanup also.
Okay, thank you. Does anyone in your family have a history of working in healthcare, and did they inspire you to apply for this school? Anybody?
Yes, I can take this one.
Okay.
Hi, class. So, yes, pretty much my whole family is in the medical field. I am Filipino, so it's kind of our thing. Yeah, so they're all nurses. And at first, I always felt pressure to start becoming an RN or something in the medical field. But after having patient care, I really, truly, I feel like I belong here. And I actually really learned to like it instead of just feeling like I was forced into it. So it's actually like really nice. I'm enjoying it so far.
Okay, thank you. Tell me about a time you were placed under high pressure at work or in school, and how did you respond to the pressure? Anybody?
I need to have a really good. I don't want to be too real.
Okay.
Okay, so I work as a PCA at Orange Coast Memorial in the telemetry unit, and there sometimes they have overloaded us with like 14 patients, which is not the usual. So there it can be very, very stressful. I have very sick patients. A lot of them are confused or total care, like they can't even move themselves. And so then sometimes I have RNs that don't even help or want to assist with cleaning or anything. So with that, I made sure to communicate with my charge nurse and the resource. Luckily, we have a resource nurse at night. So I made sure to ask them for help when my RNs were not willing or not able to help me.
Okay, thank you. What life experiences inspired you to pursue a career in nursing? Who hasn't answered yet? Amy, what life experiences inspired you to pursue a career in nursing?
Because in my perspective, I would love to be a good nurse so I can take care of the loved one in the future. That's my long-term goal. So if you have a good purpose, keep pushing yourself. Never give up. That's for next generation and for you guys. The best advice that I can give to you. Thank you.
Thank you. So as far as preparation for this, for Golden West, was there anything that you did in particular to make yourself stand out from the rest of the applicants? Anybody yet?
Prepare for nursing school.
For nursing school, yes.
Yes, I'm old, so I'm prepared for 4 years before I go to nursing school. So I take the class if I have time because I have another job. As a massage therapist. When I come to class, after finish, I go to a job. So I take 4 years. So try continue and continue. At the end, I come here.
Okay. All right. Is there anything that you can offer my class as far as any advice or suggestions in terms of preparation for the nursing program?
Mia first.
Mia?
I would say like if you choose your nursing program, you gotta know like why you in this field for, and then when you're in this field, you're preparing for it. So you need to, if you plan to apply for a nursing school, you need to go look for their criteria point, like how to the system, how to like they're gonna accept you. And based on that criteria, like point, then you know exactly what you need to do. Like you might need to take this class extra on this, like some volunteer experience or maybe work experience before you apply. That's make you stand out.
Okay. And then
Yeah, I just wanted to add on to that. That's a big thing, is looking up the schools that you're applying to. Everyone says to just apply everywhere, but depending on their criteria, you could have like an 80 out of 100 on one school's point system, and then like a 54 on another school's point system. It really just depends. And then like some schools, they only take like a class that is taken at their school. I think, I can't remember which one. I think it's Santa Ana's application. They only accept the pharmacology that you take at their campus, or like the nursing pharmacology.
that's good to know.
If I can remember that, if I'm remembering that right. But yeah, know your school's requirements.
It was advice for them, right?
Yes, advice.
Okay, so I have some advice. We had some high schoolers on campus, and what really encouraged them is when I told them that grades do matter, but it shouldn't discourage you fully from applying to nursing school. Like I can say from my personal experience, I was not, you always hear like, oh, you need a 4.2 GPA and you need like a really high T score, which is true. Like you should do your best, but it's not necessarily like, if you get like a lower score, you should just quit nursing forever. So I think there's a lot that goes into it, like your personality, your willingness to learn. If you show that you're really eager to learn and you just have some, some other quirks under your belt, don't be discouraged to apply. I strongly encourage you. Like if nursing is your passion, you should go for it, because they can tell. Yeah.
Remember what is inspire you to become a good nurse, right?
Okay. Live, laugh, love. Okay.
I have a suggestion. I
Yes.
really suggest to work in the hospital in some capacity. The best one I think you could do is work as a nursing assistant somewhere. It'd be better if you worked with like really sick patients, so you can really see like the worst of the worst and get out of this profession before it's too late. So like you could. Cut that out. I mean, like you could really know what you're getting yourself into before you're fully invested, and then now you don't like it. So just know, so you'll really know.
Okay. All right. And any other words of advice? Like, should I know my pharmacology? Should I know my pathophysiology?
Take pathophysiology.
Take pathophysiology. A lot of the clinical instructors are really big on your patho, so know your patho.
Okay.
And actually understand it, don't just memorize it.
Okay. Cool.
Yeah.
All right. Anything else, guys, that you can offer?
Good luck.
Good luck.
Best of luck.
Tell me something.
Okay.
Oh,
Nick.
Hold on, get my good side.
Okay.
So, stop. No, so basically, whatever you're learning in your yes, thank you, prerequisite class, just make sure learn it, remember it, everything, because that's gonna be your foundation to nursing school, because you're not gonna review any of it now. And if you have like your loved ones that's in the nursing field, like your significant other and whatnot, listen to him, listen to her, because she or he knows best. Okay.
Okay.
All right.
All right.
That's my tip.
Well, thank you for all the guidance, guys. Can you guys, you have anything to leave, at least as far as your experiences with 160 so far? How would you say your experience has been so far?
160. Professor Hernandez is a really good clinical instructor.
Yeah,
Oh.
if you get him, you're the lucky one.
Yeah. instructors out here, yeah, they'll give you a wake-up call. But he's strict, but also encouraging. And you guys probably see that in your pre-nursing class, right?
Okay. Thank you.
I put some good rapport for you.
Thank you
I
guys.
definitely feel like all the faculty here is very supportive. No one's out to get you, so I really do feel like this is the best program. Haven't heard that about a lot of other programs.
Okay. All right. Thank you, everybody. Appreciate it. Bye. Bye.
Can I